Hi, welcome to the 8th episode of Ask Giri, the Physio Show. Today we're going to talk about the most common issue affecting everybody, that's back pain. So, back issues again, let's discuss how to deal with it. There's only three givens in the life: death, taxes and back pain. So nobody can avoid it, right? The prevalence is very common. They say at least 80% of the people who are living in this world would have experienced back pain at least once in their lifetime. And they say that another 20% might have had it, not remembered, or not even paid attention to it. So that's how prevalent back pain is. So, pain. We talked lots about in our episode Pain 101. The people who haven't watched it, go back and watch Pain 101 episode in physioshow.ca website. You can check it out. For other people, so when you have pain, for example, back pain, you got, because of various reasons, you're having back pain, and the pain travels from your nerves to the spinal cord, from the spinal cord all the way to your brain, right? What you're feeling in the back is just basically, we call it nociception. It's just electrical signals. The pain is only perceived at the brain. Brain is a product of the brain. So, not just one part of the brain, various parts of the brain, starting from prefrontal cortex all the way to amygdala, which is the kind of a limbic system. So many different parts of the brain, it comes into play, how you perceive the pain. So, and also there are a lot of amplifiers, we call it, which also augments, which can increase or decrease the pain, how you feel or how your brain perceives it. So what are the amplifiers? So you can see it in the slide. The four main amplifiers is the cognition, right? How much attention are you giving to the pain, for your back pain? And what kind of distraction you're having when you're having back pain? And how catastrophizing it is, right? And are you really saying, oh my God, this pain is killing me, I can't do anything, it's going to get worse. And you're having this cyclical thoughts of, oh my goodness, I can't do anything, I lost control of this pain, and what's going to happen to me? What kind of thought process going in your mind? That is actually most single important factor in determining how well you will cope up and recover from the back pain, according to the research, right? And next one is a context. Beliefs. What is your beliefs and expectations? Have you had back pain before? How did you overcome that? And how is your experience of back pain with your friends and family circle? What did you hear from them? What kind of expectation you have regarding your health and your outcome of the treatments or outcome of the back pain? So that matters quite a bit as well. And how motivated are you to get better and go ahead, right? And placebo effect, it's also very common, like, when you take a pill or any kind of passive modality, how it affects you in terms of pain perception. So that's also important there. Then the mood. How's your mood? Are you depressed? Anxious? How is your vagal system? That is, the vagal system is activating your anxiousness. And emotional. How are you doing? Handling it emotionally with yourself, with your family members, with your colleagues, with your professional team treating you for back pain. How are you handling all these things, right? So that's very important. And also individual differences, right? Any genetics, there's a little bit of things, how the whole family history, and also the gender, male and female, they handle pain a little differently. History of injury. How was your previous injury? Anything happened? How did you recover from that? How long did you take, and how active you are, and any remnants or residual effects from that injury still affecting you? So you can talk about that as well. And atrophy, that means if you don't do anything, your muscle is going to shrink. That's your atrophy, right? So these are the amplifications or amplifiers on top of your pain perception in your brain, which can alter the pain. Either you feel more or less, depends on these amplifiers. That's why it's not just a tissue injury and the pain, right? People always thought the pain I'm feeling is equal to the tissue damage, which is proven very wrong. You may not have tissue damage, but can have pain too. So where is that pain coming from? You have to ask yourself that question, right? So then the types. There's lots of different classifications, different varieties. We can talk about it all day, but we're not going to do much details of what are the different types of that. But we're going to based on that basically two types we're talking about here. One is the axial or referred or non-specific back pain, which is very common, almost 90%. So I'm going to grab the spine here to show this axial pain. Axial is axis, right? So this spine is your axis right here, right? So the pain coming from here. So what are the different sources which can give you this axial pain? which can be coming from your joints. It's your facet joints right here. It can be coming from your vertebra. You can have a vertebra here, right here. You can have a compression fracture or degeneration there. It can come from there, and it can come from the disc, right? The disc can be degenerated. That can give you some axial pain as well. So these structures can give you axial pain and referred pain. Referred pain can go most likely up to the knee, and it can be so it can be near buttocks area, it can be near thigh, it can be the side of the thigh or the front of the thigh, and most of the times the referred pain kind of stays at the knee level. That's the main way you can differentiate the referred pain and the radicular pain. That we'll talk about a little bit later. And this is the sources of the axial pain. So for the radicular pain, you are touching something very sensitive, right? It can be, look at these nerve roots coming out right here. If that nerve root is irritated due to various reasons, common cause is the herniated disc. If the disc is herniated, compressing the pressure, putting the pressure on the nerve root, you can get radicular pain, which can go really down below the knee as well and all the way to your foot and ankle as well. And it can be a little bit of a narrow band compared to your referred pain, which can be a little bit wider band. So that's the main differences, and your physiotherapist will know when they're examining you, right? So that's the radicular pain. So radicular pain mainly is your spinal cord and your nerve roots. That's the main source of pain. And your axial, referred or non-specific is usually your bony structures, your ligaments, your muscles. Those are the main sources in there. Hope you got a little idea about what structure can cause what kind of pain and how you differentiate that. Conditions, what are the conditions? Like, you can say if it say top 3 causes of back pain, if you say, I would say number 1 is herniated disc. The disc herniates and puts the pressure on the nerve, you can get a radicular pain in there. Sometimes disc herniation also may not have radicular pain if it doesn't compress the nerve root, right? The next common one is your stenosis or narrowing of the spinal canal right here where the nerve comes through. And that's due to degeneration and or due to any kind of other pathologies, osteoarthritis and things like that. The third one is your SI joint and pelvis, which we'll talk a little bit in detail right here, right? We'll talk about that later. So that's what I want to just give you a small glimpse of what are the different types and what are the kind of sources of back pain in here. So hope you got a little bit idea about that. And I want to really clarify a lot of common back pain myths in this episode, because this is the most often things we hear from the patients and why it is not true, right? The first one is, when I hurt my back, I have to lie down and rest for a couple of days. Rest is what something we advised in 1800s and early 1900s for back pain, but not anymore. The more, once you ruled out the red flags of any kind of cancer or compression fracture or any kind of severe neurological insult, once you ruled out that, rest is not advisable. The more quicker you move, it's better for you, right? And that's where your physiotherapists and healthcare practitioners comes into effect to help you to rule out the red flags and get you moving as soon as possible. So again, you do not have to lie down, right? And you have to keep moving. I need a scan for my lower back, right? People think scan is a treatment sometimes, everything, once I know the scan, I know what's going on, then I can treat it. Most of the time, you do not need a scan unless your physiotherapist suspects any kind of red flags, and we need to do a scan to rule out the red flags or to confirm the clinical impression. For example, if you take scan for about 100 people who are about 45 or 50, 80% of them will have some kind of a disc pathology, right? But may not have back pain. So that's what you have to understand. And we also have this group of people, we call that VOMIT. It means victims of medical imaging technology. People so fixated in their scans and x-rays and saying, oh, this is what I'm having pain for. This is why I'm having pain. I can't do anything about it. My disc is collapsed or whatever it is, right? So, and also another thing is a disc is slipped and stuff like that. Disc doesn't slip actually. It just, some of the content might come out. The disc will still sit in the same place. So those are the things, myths we have to make sure that address that and also understand what is the evidence and what the real knowledge is. That's the whole point of this episode, to educate and empower the knowledge about back pain for you guys. Again, my back is weak, my spine is weak and fragile. Never ever think that. Your spine is one of the strongest structure in your body. It can bend, lift, pull, push, carry, whatever you want to do. It's very strongly created. So do not think it's fragile for once. right? You don't have to be like this, very careful. Once the things are ruled out, you can move freely based on your pain perception. And my back is out and needs to be put back in. Nothing goes out anywhere, okay? And out is a very big term to use. Out means, in my dictionary, it's dislocation. If you're dislocating your vertebrae or your spinal column, you won't be walking into the clinic. Most likely you need much more attention and care. So that's a very strong term to say the back is out, and then somebody has to put it back in when it's out. That's not the way. When we work on your manual therapy, sometimes the joints may not move very well. We might have to manipulate or do a thrust maneuver to get it moving. Most of the times, a gentle mobilization will help to relieve the pain and get the joints moving. So we are not putting anything back in place, which is out. So I just want to clarify that. My back aches all the time and there's nothing I can do about it. That's going into the kind of a denial and acceptance and things like that. So don't go there. There's always a way and you can get help. If something doesn't work, you can try something else to make it work, and having that mindset to get better and then approaching that is very important. So these are some of the myths I really wanted to address here in this episode. Ask yourself, if you have back pain, how long have you been having it? And how did you handle it? Or if you don't have it right now, when was the last time you had it and how did you handle it? The 3 ways people usually handle that, right? So did you ignore it? Did you totally ignore your pain and then kept on going and it got better? Did you do that? Or did you try to alter it? Altering by taking pain medications or hot packs, or sometimes, without knowing the proper reason, taking a corticosteroid injection to shut the system down for some couple of months without really acting on the cause. What did you do? Or did you try to fix it? Fixing means you are going to seeing a appropriate healthcare practitioner, most likely your physiotherapist, get it properly assessed, everything, find out the exact cause of your back pain and work on the cause, right? Most of the times in our assessment, if I can reproduce your symptom, I can reduce your symptom. So that's the main thing. If I can reproduce, I can reduce. So that is a very important thing, fixing it. So don't go for either ignoring or altering. There is a reason why you're hurting. Maybe you find the cause why you're hurting and try to fix it. And that's where we come in, right? So, and also do not forget, when you talk about the spine, most of the times x-rays are taken for the spine, and most of the time some practitioners miss out on the SI joint, which is your sacroiliac joint, and the pelvis as well. I got to grab the spine again. So these two are your sacroiliac joints, the joint between your sacrum, which is your pelvic bone, the sacrum, which is your tailbone, and your ilium, which is your pelvic bone right here. This is called sacroiliac joint right here. There's a lot of muscular attachments coming that area, and then so many ligaments are connecting here, not only in this area, plus your sacrum to the pelvis and the other areas as well. You could have strained some of the ligaments, you could have strained some of the muscles, or maybe this, it's not kind of moving very well. There's not actually a lot of movement in this joint, but still, if you have any inflammation or overloaded in this area, you can have a problem as well. So your pelvis is your foundation, it's your bottom block, right? If your bottom block is not stable, how the top blocks are going to work, right? So always make sure and screen your pelvis and screen your sacroiliac joint. So make sure everything is proper. Most of the times when we assess back pain patients, the common finding is a lack of hip stability, right? The first thing I assess with the lower back pain patients in my practice is assessing their hip stability, right? A lot of times in a lot of different groups of people, doesn't matter the age, a 12-year-old or a 50-year-old, hip stability is a big issue. So we assess and treat, make sure it's proper, right? And if you want to see whether how's your hip stability is, just stand on one leg and put your hands on the waist and try to stand on one leg and see how you are. And if that is very stable, try to go for a little shallow squats in one leg and see how you are. Be safe, don't fall, and you know how is your status of your hip. And if your foundation is not stable, how is the structure on the top is going to be stable and working fine, or efficiency, right? So we have to talk about that. And also, like, back pain is not always caused by the tissues in the back. So if your neck is important, your upper back is important, and your upper back, if it's not rotating and extending very well, that's going to put more pressure on your lower back. So that's when a thorough screening is very important when you get back pain beyond your back. Sometimes your back pain comes from your upper back, right? Lower back pain comes from the upper back. We don't know. So we have to find out that as well. So that's a small tip for you guys there. And then I wanted to also talk about that, again, repeat myself about that one more sentence about the MRI. So if you're over age of 35 and have no back pain at all, and you most likely will have an abnormal finding in the MRI. That's very normal. So when you have an abnormal finding in the MRI, do not get alarmed and then panic. And then it is very normal to see that, and you just have to get treated and keep moving with your back, unless the red flags are there, right? So exercise is always proven to be the best approach to lower back pain. There are a lot of different models. So we are exercise based professionals, right? We have to get you guys moving, and there are some important points you have to remember is one size does not fit all in exercises. Every person is an individual. We have to assess you individually, screen you completely, and create an exercise program based on what's missing in your body, and also dysfunctional patterns, and correct those patterns, and give you the appropriate exercises. So don't think you can just go to YouTube and do the top 3 back pain exercises and get better. It may not work all the time. So get proper assessment and done, and get your individualized treatment plan done. And the next thing is, and you have to explore different several approaches, and see what works for you, right? So there is a direction based approach we call McKenzie approach. Some people it might work really well, and some people just the trunk motor control approach, and doing the motor control exercises will really work. And it's not, again, one approach for everyone, right? We have a lot of tools in our toolbox, and depends on what works for you, and we can use that for you. So that's why you have to approach your physiotherapist with tools so that they can fit you in where your body responds well, right? And aerobic exercise is proven to be really helpful, and at least 3 to 5 days a week, totally kind of 150 minutes per week at 55% of your maximum heart rate. Some kind of aerobic activity. It can be walking, it can be biking, swimming, it can be elliptical, anything like that, and which is helpful for you. And the last point here is, always gauge your response, how you're responding to the treatment and your exercises you're doing, by doing certain basic fundamental movement patterns, right? Before you start your exercises, try to bend forward, try to bend backwards, try to rotate and see how you feel. And after you're done few exercises, and do that again and see how you feel. So that's the way you can gauge your responses, and then find out will the exercise help you or not. No point in just doing exercises and not kind of able to gauge your responses. So that is very, very important, right? So, and I'm going to just show you some exercises right now, very simple ones, what you can do when you have back pain. Again, this exercise is not for everybody and for all conditions. You have to get it assessed and treated, get an individualized treatment plan. And this is just to show what are the simple things you can do in different positions. What you can do on your back, what you can do on your tummy, what you can do on all fours, hands and knees, what you can do in half kneeling, what you can do in standing. Just I'm going to touch a little bit on a couple of exercises on each positions so that you can be aware, oh, you can do as simple as this for back pain. Yes, you can. Okay. Simple things you can do when you're on your back is the first thing is you can get really tight on the sides of your buttocks muscles here, and then how to stretch that. We call it piriformis stretches sometimes, because sometimes that muscle can be very irritated when you have lower back pain. Anu is here, my assistant and my model for this presentation. She's here, and I'm going to show how to stretch your piriformis. So Anu, you can straighten this knee for me here. Let's bend this knee and bring the heel across that leg. And can you use your hand to hold on to this leg and pull it across gently. You be the driver for this, and see, can you feel the stretch? Okay, then go a little bit beyond, and then is that okay? It's not too painful? And you can hold it there. So you can do the stretch like this on both sides, hold it for about 20-30 seconds and see how you feel, just to get the body part moving and get that muscle stretched a little bit. The simple things to do when you're on your back. The another one you can do is also kind of bring your knee to the chest. Hold on to this, Anu. Get on the top of it here. Yeah, go and just hold it there. Make sure the other knee is down, flat. It should not come up there. So that kind of determines how tight your hip muscles are. Make sure that that leg is down, and this is nice breathing in through your nose and out through your mouth. Always make sure that you engage your diaphragm when you're doing these exercises, because a lot of people hold their breath when they do it, which is not at all good, because diaphragm is very important part of your the whole core system. Okay, so those are the two simple things you can do on your back. On your tummy, Anu, can you go on prone lying? So on your tummy, you can do a couple of simple things. Is sometimes for some conditions, as I said, it's not the exercise for everyone. You have to consult with your physiotherapist to kind of what is appropriate for you. I'm just showing what are simple things you can do to kind of get things moving. So we can call this cobra, or we can call this McKenzie extension, whatever you want to call it. Keep your hands by the sides of your chin, and then just push up up, keep coming as much as you can. Go. Okay, sometimes you may not be able to go all the way up like that, what Anu is doing right now, but she doesn't have any back pain, so she can do this far, but sometimes you may not be able to go that much. So you might be able to go just there, and that's fine too. And stay there for about 10-15 seconds and then go down all the way down. Wonderful. Then come up again. Make sure you do them like, at least 5-10 times based on what you can do. It can be as simple and as small as you want, okay? It doesn't have to be perfect. Nothing is written on stones. Whatever you can do, you are the driver of your exercises. And respect pain and respect what you feel and be aware of the body movements. That awareness is very important. Don't have the music blasting on you when you do these exercises. Pay attention to how your body is moving, how your spine is moving, how your leg is moving. That awareness and breathing really brings out a lot of good things when you do exercises. The second one is also on your tummy. You can do most of the times when you have back pain issues, it can shut down your gluteus muscles, your buttocks muscles. So a lot of times when you assess the patients, they don't have hardly any kind of firing in the glutes at all. So a good way to activate your gluteal firing is bend your knee, we'll do on the right side, and then lift this leg off the bed for me, and just bending and lifting as much as you can and holding it there for about 5-10 seconds and going down. And make sure you're not rotating your pelvis, you're not twisting your pelvis or anything like that, and then go down slowly. Make sure you breathe nicely and then do it on the other side. Good. Up. Good. There you go. So these are the simple things you can do on your tummy. Okay, now we're going to show what you can do on your all fours, which is your hands and knees. Okay, just one exercise I'm going to show you. Again, this is mainly for your activation of your all the extensor muscle groups, including your glutes. And we can lift. Can you lift your right leg up, Anu? Yeah, good. Higher. Good. And you can just do very simple as this. If you want to make it progress into the next level, you can also do the opposite arm up. Okay, we call this bird dog for some reasons, and so this is activating the whole chain, your latissimus dorsi, your glutes, your hamstrings, the whole extensor chain. Then you can switch to the other side, and when you do this, make sure that your pelvis is not twisted, it's not nice and straight, a nice form, and also breathing is being done. Okay, again, you can start small and go with this progression as well. Then we're going to show just one exercise in half kneeling, just to show what are the different ways we can do slowly from lying to going up to standing position. This posture is called half kneeling. In the half kneeling, Anu, can you show a chops for me? Hold your hands together and let's take it from this here and then go all the way to the other side. Look at the things. So this is called half kneeling chops. It's a very good exercise for the hip stability as well. And you can do it on both sides, maybe 10 on each side. Okay. Then I would like you to stand up for me, Anu. So in standing, you can do a couple of simple things as well. Remember the extension we did on your tummy? You can sometimes you may not be able to lie down if you're in the office, you're sitting and working, you want to do some extensions, you can do it in standing as well. And turn around, face the wall, put your hands up there and step back a little bit and then extend from here. Yeah, so you're extending from here, and also it's a good stretch for your long muscles, especially the guys coming from your shoulder all the way to your pelvis, like latissimus dorsi. It's really good one. You can go there, nice breathing, stay there for about 10 seconds and relax. Maybe do 3 or 5, as simple as that. And then, Anu, can we do a lunge and show the forward lunge? So you're going to put one leg in the front and just a very gentle lunge. Bring the knee on top of the toes there, and you don't have to bend the other knee. You can keep it there, keep the heel down. Just being there, just moving the hips, activating your muscles in the back, and switch legs. You can do maybe 10 on each side, 5 seconds, 10 seconds hold, whatever you guys want. Simple things like that. Thank you. So those are the couple of things you can do in standing. There is millions of exercises. Your therapist will assess you and give you appropriate exercises and then take you progressively up, starting from very simple exercises to the advanced exercises. There's a lot of advanced exercises you can do with a lot of tools like a physio ball we have here and the kettlebells and then a lot of other things as well. Just a couple of small things you can do with the ball. I call it just sitting, going back. So have a seat on this, Anu, that way, yeah. So this one you have to be careful when you do that, and you have to get used to the ball first. Sit and get the stability, keep your feet nicely firmly on the ground, and then you can keep your hands across the chest. Bring the ball forward with your bum and then take your spine back and you're looking up there and head in line with the trunk and nice breathing. Now this really activates the back muscles and the core muscles and everything, and then come back straight up. And breathing is very important. Don't hold your breath and make sure your neck is in line with the trunk. Okay. Next, you can do a plank on the ball as well. Anu, can you show a forward plank on the ball? So before doing forward plank on the ball, you should be able to do the plank on the ground first. Don't go straight away to the ball. It's all advanced exercise, I told you. It's not for somebody to acute back pain to start with, right? And then keep your pelvis down a bit and nice breathing and just holding it for about 10, 20 seconds. Start with 10 seconds. You can progress to 20, 30 seconds as well. Thank you, Anu. So those are the exercises. Just so you can start with, keep moving in that. As I said, to get to your individualized treatment plan, you got to talk to your therapist about that one. So these are some of the exercises. You can try and see if it helps you or not. As I said, it can be as simple and as small as it can be, right? Next, even though we need strength, mobility, flexibility, endurance, speed, agility, everything, do you know what is the single most important performance attribute for 2020? Right? Is it your speed? Is it your strength? Is it your intelligence, agility, or power? No, none of them are. So what is the most important performance attribute for 2020, the world we live in? It's adaptability, right? That is the most important thing. So how much are we adaptable, or how much are you adaptable for the changes happening to your body? And what is that scientists and the researchers are saying about the changes happening, and how much are you educated about it, right? And how you're adaptable for the changes happening in your mind. So many things have changed this year for all of us, right? And the way we work, the way we commute, the way we do things, way our kids do things, a lot of things have changed. How are you adapting your mind to it? And how are you adapting to the changes in your life? That's a good question to ask, right? And also to changes in the world we live in, like how we live and how we work. A lot of people are working from home now, and the way we do things are different, and how we eat and express, right? And how we exercise, how we express our body and mind, and how we express our civic duties. The most important civic duty is right here, right? How are we expressing ourselves through this? You have to ask yourself, this adaptability is considered as one of the most important performance attribute for 2020, right? And that's how I would like to conclude this episode. And then we're going to move on to the couple of questions from the audience. And we're going to address that, and then we're going to wrap it up, right? The first question is from Jenny from Edmonton. She's asking us, are core exercises more important than other exercises for back pain? The answer is no. There is no evidence that core exercises are much more superior to any other exercises for back pain. So basically, you got to move right? To strengthen and stabilize your core. In the later stages, we can do advanced exercises, but core exercises are no way superior to other exercises for back pain. And again, people think always core exercises means you got to lie and do a lot of crunches and things like that. No. When you stand and when you just move your arms like this, you're activating your core right now. For example, if you're holding a tubing away from your body like this, you resist any movement, especially rotation or extension, you resist any movement, and that will activate your core. Okay, that's another topic for another episode. We'll discuss more about it, but the answer is no. Core exercises are no superior than other exercises for your back pain. And the second question from our viewer Matt from Sherwood Park is, are bending and lifting exercises like a deadlift is bad for your spine or bad for your back? Right? I said, if you remember what I said before, your spine is a very strong structure and versatile structure, right? Once you clear yourself for the movement first without doing any big lifts, you kind of get assessed by a professional saying that is your movement pattern is right. In my first episode I did is about move first and load later. You might want to watch that one. So first make sure you move right, and then you start loading that movement. So deadlift, proper posture, proper hip hinge, proper technique. You make sure you're doing it right, then you can start gradually loading your deadlift, and your spine can handle that. Spine is a very strong structure, so lifting and bending is not going to affect your spine that much if you have a healthy spine. But if you are coming from a back pain rehab, again, you want to get everything cleared by your therapist when you can start lifting weights, how you want to progress, how your movement pattern is, what is the dysfunction is. They will help you with that. So that's where it comes in. So that wraps up our episode for back issues again, or back pain again. If you like it, please share it with your friends, and subscribe to our YouTube channel. We are on Facebook as well. If you want to watch any of our previous episodes, please go to physioshow.ca. All our episodes are there. And also, if you have any questions or any queries, you want to reach out to me, if you want to pick my brain, please email at giri@physioshow.ca. Thank you for joining me in the episode, and I will see you next month with a beautiful another episode. Bye.